out. Sorry, I'm signing. This is one thing that we can fix. A new medical consultation because right now for the ABC patient with the ABC social security number, that identifier medical consultation with identifier otherwise for Pedro Paramo. So this is one thing that we can improve at the enable systems. I'm going to create a new one. It's not a big deal, believe me. Same, and only I'm going to add one file. No, I only add PDF files in this case. To pull out, that's all, and additional data, children, like I have before. To save, marriage, save. Got it. And now is a new consultation identifier. But if we want to create a new medical consultation, it is already working. Let me see. I don't want to take any risks. Please log out. Better log out or log in and sign in once again in order to clean up the memory. It's not a big deal. We can fix it. It's not really a big error. Remember that it's a beta version, and that is, of course, we can have many areas or chances to improve or enhance, create new enhancements for a platform. So that was search medical consultation, patient history, like I said before. That is the patient history for that for Pedro Paramo, and we can of course go back to services and patient medical history. Now I want to see the patient history for ABC. Take care, because this is an uppercase. Got it? And that's all. What about what else? Well, the apps. For instance, I'm going to show you just a couple of apps. The COVID-19 detection, that every entry point, each entry point for each app is the same. It started by social security number. It doesn't matter if it's COVID-19, brain tumor, breast cancer, and so on. Got it? I'm going to show you social security number, ABC, find, and one thing that it is important. It is important not to take this detection as absolutely certain. If you're not a doctor or you are using this platform outside of a professional context, we recommend you to visit a doctor. Patient data, once more, the patient data card, and how it works, this app. Well, you have to load here your lungs radiography, for instance. I have it right here. Just scan viral, for instance. Once you have selected the file, do not forget to click on upload. After uploading the file, it will start the process. What process runs the algorithm, and it will tell you if COVID-19 detection, the results, and the accuracy. Then upload. It says one file has been uploaded, COVID-19 detection, yes, with an accuracy of around 81%. Got it? And then in the patient card, now you can load the detections, and you will see that there appears one new detection for this patient with the date and the type, COVID-19 positive, and the accuracy. Who attended this session, you can also see the data of the medical doctor or the user that runs the algorithm, and of course you can view the resource. Got it? You can add as many resources as you want. But well, what else? If we go back to the dashboard, then we can see right now that we already have last detections, the date, the result, detected COVID-19, accuracy, patients. You can see you can make click in the buttons and in order to see the patient data card. All right, who attended by, and you can view the resource, and also of course you can see the charts right now. All detections, positive and negatives, pie chart. We have only COVID-1 detection, 100%. Positive detections, pie chart. Negative detections, we don't have any. Negative, result negative. All the detection, positive and negatives, bar chart count. You can export, download your charts in PNG or SVG format or CSV, for instance in PNG image format, and we have the chart. Positive detections, bar chart count, 1 positive so far. Negative detection, bar chart. We don't have any detection with negative result. All the detections, positives and negatives behaviors over the time, just 1 point in the time, with the date of August 15, 2024, related to COVID-19. Positive detection behaviors over the time, 1, and negative detection behaviors over the time. For each chart, it will say, and it's collapsible, these panels, in order to not make too longer the vertical scroll, and you can collapse the charts. You can see the title for each chart. All detections, positive and negatives, pie chart, percentage. Positive detections, pie chart, percentage. Negative detections, pie chart, percentage. All detections, positives and negatives, bar chart, count. It's a counting. So what else? For instance, I'm going to run another detection, Alzheimer detection, for instance. Now for the other patients, this was for Peter Pan, has ABC. So I'm going to run Alzheimer detection. Now for 1, 2, 3, fine. And once more, the patient data. Remember, it is important not to take this detection as absolutely certain. Got it? If you're not a doctor or you're using this platform outside of a professional context, we recommend you to visit a doctor. The patient data card, per Paramo, we already know it, and this patient data card. Load here your magnetic resonance image, your MRI file. Once you have, remember, you have to make click. Like it's here, I have some MRI images. Sorry, and ULAT. The process is very similar in case for COVID, but each app is different. And ULAT. Alzheimer detection says that not, and the accuracy says that unable to determine the detection accuracy may be a false negative. Please take care, like I said before, is not so do not take this as absolutely certain. Remember that the algorithms are based in other work by this person. So what else? Then we can go back to the dashboard, and now we can see that we have 2 detections, one negative and the other positive. One, the negative for the Alzheimer, the positive for COVID, and you can see who patient is, who attended this session, view the resource for each detection, and so on. The less patient data, and of course the charts now is different, because for all detection, positive and negatives, pie chart, percentage, now we have 50% for Alzheimer and 50% for COVID. We have positive detections 100% for COVID negative detection, 100% for Alzheimer, just one. All the detections, positive and negatives, bar chart count, 1 positive for detection, for COVID, sorry, and 1 for Alzheimer detection. Positive detection by bar chart, just 1 for COVID, negative detection by bar chart, 1, just once for Alzheimer. All the detections, positives and negatives, over the time, 1 for both COVID and Alzheimer. Remember, positives and negatives. Positive detection behaviors over the time. We only see 1 point because we have, if you run this data or new detections tomorrow, for instance, then we can see another points in the space. Perhaps later I'm going to make that test and I'm going to upload just screenshots with that in order to see that a line is displayed instead just 1 point. So positive detections over the time, behaviors over the time, just 1 related with COVID-19, and negative detection behaviors over time, also just 1 for Alzheimer with that day. Got it? Well, what else? I think that that's all in general terms related with the main functionality for health services platform. We have created a new patients, 2 new patients. We have created new medical consultations, search for medical consultations, inspect or view the patient medical history. Remember that we have some issues. If you want to create a new medical consultation, please, at this point, it's something that we can fix in brief. Perhaps when you want to require, if you want to try, give a try to the platform, we can fix it. Or perhaps that is one of the goals for us to participate in crowdfunding campaigns to retrieve resources in order to give support to our students, to the students that making internships at the naval systems, to make that little tiny improvements and enhancement for this platform. And the apps, we also see the apps, COVID-19 and Alzheimer. Each app behaves in different way. For instance, breast cancer detection not requires an image, requires the concrete points mean, the area mean, the radius mean, perimeter mean, the mean. That is very particular for ES-based. Remember that in the algorithms of this person, the Abhishek Sharma. Glucose level, in the case for diabetes detection, blood pressure, skin thickness, insulin, body mass index, diabetes pedigree, and things like that. Well, what else? I think that was the general and the most important functionality in the platform. Of course, like I said before, you can inspect your user account, change, I don't know, I want to say that mail, and say the field, the phone number is required. I'm going to use this. Say day of birth is required. For instance, I don't know. Say data updated successfully. I can change also the organization in which I work. Here in Mexico, for instance, we have the Instituto Mexicano de Seguridad Social, IMSS. Number 5, for instance, I work in the IMSS number 5. Say your job profile has been updated successfully, and you can change your password, change your photo. For instance, I'm going to pick one photo and save. Your profile photo has been updated successfully, and the page reloaded, and you can see now your photo here. Change to English, change my photo, I want to remove, and save. Your profile photo has been updated successfully, and then I don't have any photo for my user account. So I think that that's all. Perhaps one last thing is that here in the dashboard with this button, you can see, let me change to about the charts. The chart, the functionality, as well as the detection apps are some elements that give us distinction and make us different from the rest of the platforms, apps, applications, portals, websites, or pages, and others, and that can be similar, more or less equal to, or a proposal. Yes.